Here are the two surgical kits for GM in the United States. The Titamax drilling sequence will not be shown in this overview of the kit because Titamax is not a popular implant in the United States. For less confusion, it's best to remove it if you have the full complete surgical kit. Here are the regular set of drills color-coded in the first top row. We have a drill extender, and the second set of drills are the plus drills. And then we have the contour drills. The plus drills create a wider osteotomy than the standard drills. Here are the pilot drills to be used in type 1 bone. Parallel pins are all here and correspond with each implant diameter.
Located on the bottom of the kit is the GM driver to place the cover screw or healing abutment,
the contra-angle converter for use with fingers, the implant driver for latch, the implant driver for the torque wrench, short and long, and finally, the height measure tool to take the measurement of the mucosa or soft tissue thickness. These are the parallel pins to help check the osteotomy. After using the first drill, put the pin in and visually check the position of the future implant. They are labeled as 3.5, 3.75, 4.0, 4.3, and 5.0 in their color codes because each pin corresponds with the same diameter of the last drill. On one side is a small diameter, which is the same diameter as the first drill. There is a wider diameter, and that diameter is the same diameter as the first drill. In the middle, there is a hole, and this is where to put dental floss to avoid complications in the patient's mouth. All that's needed is to follow the color code is the implant diameter. Once the last drill is placed, check with the same color parallel pin. For example, when using a 4.3 yellow drill as the final, take the yellow pin, which corresponds to 4.3, and place it inside the osteotomy. Make sure to have a good stability of the pin inside of the hole. When drilling, make sure to confirm the label on the bottom portion of the surgical kit. The first one is 8 millimeters. The second one is 10, 11.5, 13, 16, and 18. A good tip is to memorize bottom of the wide silver marking is 11.5 and the top is 13 millimeters. That makes it easier to memorize where the 11 and 13 is, and then after that, the 11 is clearly visible. Then the 10 and the 8. Same thing on the top. This is 13, and this is 16 and 18. There are 6 open spots where you can place extra tools. For example, prosthetic drivers, short or long drills, or other items that could be in a surgical kit. Consider that all GM implants have the same internal prosthetic connection dimension. There are 3 implant drivers, one for latch or contra-angle, another one short for torque wrench or long for torque wrench. When placing an implant by hand, there is a converter that converts the latch driver for manual placement.
Underneath the surgical kit, there are tweezers with a 1-to-1 ruler.
The depth gauge is labeled. The first mark is 5 millimeters, 7, 9, 11, 13, 15, and 17. Make sure that the round side placed inside of the torque wrench. First, hold this area. Make sure the round side is up and match it with the round logo of Neodent. Afterwards, put this together all the way. making sure there is no gap in this area. Tighten all the way to the end. And lastly, make sure that the arrow direction is in the right position, looking to go in or out. So, for example, this is a direction where the arrow is counterclockwise. So, after putting something in, to remove it, rotate counterclockwise. The reason for disassembling and assembling the torque wrench is because during surgery, there might be saliva and blood in these internal portions. And if kept assembled, there's no way to clean it properly. If the torque wrench with all the parts are together, it's best to open, take this cable out, and remove all the parts to have it clean, dry, and sterile. The other thing that's important to understand is why the round and the square. When the square is together in this direction, there won't be a way to engage the torque driver here, and there won't be a way to use these accordingly. Make sure that this portion here is in the right position. Remember that round is correct and the square is not. Make sure that the label is facing up, and make sure that the round is matching the Neodent logo and the arrow as well.